10 symptoms of stroke. Stroke is becoming a nuisance. Stroke is becoming too common, affecting even younger people. Unlike everyone thought it is for old people, that people who are 70 years, 80 years, 90 years, they are the ones that get to stroke. My dear brother, if you find a 30-year-old boy or girl suffering from stroke, let it not be a surprise to you. 40 years, 50 years. A lot of activities in our lives, the things we involve ourselves in, the type of stress some of us subject ourselves in, you are at risk of anything, including stroke. We are talking, this stroke is what is also referred to as, how do they put that? CVA. The word CVA stands for what? Cerebrovascular accident. Cerebral, it has to do with the brain. Vascular has to do with the blood vessel, the circulation of blood. The vessels, blood is circulating through. You can imagine accident in the blood vessels in the brain. What could be happening? That a blood vessel could break. That blood could leak in your brain. Will your brain still function very well? Will your brain still control the nervous system, so that your hand can act well, your body can act well, you can talk, articulate well, you can eat, swallow well, you can move, you can do everything. It's your brain that is which is the principal center that controls all of this. If such accident occurs in your brain, are you sure you still function very well? Certainly no. I give this introduction to tell us about the severity of this simple word stroke as a health challenge. What are the symptoms? Watch out. Watch out. Remember, every health problem, early diagnosis is the key. If they start seeing signs early, something can be done fast to reverse the situation, so that you don't even end up having the stroke. Because it doesn't just fall, boom. It has signals. This is the interest of this video. My name, Dr. David Ayim, your reproductive health expert. This is the focus of this video today. The symptoms of stroke. Number 1, difficulties walking, just moving, being able to walk, remove your leg and put and just walk. Somebody will notice already that just to walk around, you are already facing difficulties. When you start facing difficulties walking, now, question mark, could you be getting into stroke? Number 2, speech problems. Okay, inability to talk, difficulties just talking. You feel like your lips are tight. You struggle, difficulties just in trying to speak. When you start finding that place, you can tell even your brother or sister or somebody around that something could be wrong with you. You could be at risk of stroke. Like there's a saying in that a problem shared is half solved. Reason for which somebody may be noticing some signs, some symptoms. Instead of just staying quiet, share with somebody around you who could give you a piece of advice, who could counsel him, and then all that lead to solution. Number 3, difficulties in understanding. You may actually hear something, and to make meaning to what you have heard, becomes difficult. You start finding difficulties just to understand the things that are happening around. Number 4, paralysis or numbness. When they say the place is numb or paralyzed, a part of the body like the face, like the arm, like the leg, okay? And you will be surprised that such numbness affect one side of the body. So it is not just going to be holding you from both sides and clump you together. You notice that one side of the body, even from face down to the arm, down to the leg of that side, begin to get numb, and you begin to face paralysis there. Hey, please, the earlier you get to the hospital, the better. Number 5, blurred vision. This one is very common, that a lot of men and women sometimes face blurred vision. You feel like your eyes are dark. You are not seeing very well again. You need to clear a bit and wonder why your vision is not very clear. Watch out. Number 6, fatigue. Whole body fatigue. You just feel tired. The whole body is tired. Number 7, reduced sensation. You don't, the feeling, somebody may pick even a needle and pierce you, and you seem not to have a feeling for it, or the feeling is greatly reduced, and you feel that, on the skin, the sensation has greatly dropped. Number 8, difficulty swallowing. In fact, even just to chew food in your mouth and then swallow, you have a feeling that it is a bit difficult. You are putting it on force. Okay, watch out. Number 9, headaches. This you may constantly have headache. You constantly have headache. That you may be wondering that what is happening to me and what is worrying me, that the head is a problem. Now, number 10, mental confusion. Yes, you seem to be confused mentally. I did not say deranged. I did not say madness. No, I only say what do I say? Confusion, mental confusion. Then you need to go to the hospital. You need to call your doctor. You need to let your children take you to hospital. Have you been regular in monitoring your blood pressure? Do you know that if you monitor your blood pressure regularly, it is very difficult for you to suddenly face stroke, because it will always start presenting with high blood pressure. And if it is not controlled or properly controlled, you are at great risk. Thank you for watching this video. If you have not yet subscribed, please subscribe and like. Then you share. Make your comments. But you could talk one-on-one on WhatsApp, write or voicemail on +237 694 353141. Have a nice day. Bye-bye.